So if I tell you that you get ulcers from taking food or water contaminated with feces, you may not agree with me, but that is actually the truth. The medical textbooks say it is fecal oral transmission, meaning some stool, some feces are going through your mouth without you knowing. Hello everyone, you're welcome to this video. In our previous video we talked about peptic ulcers. Today I want to talk to you about how to prevent peptic ulcers. From the last video that we had, we talked about causes, we talked about prevention, the treatment, we talked about complications. We need to talk about how to prevent, how you can be careful not to get it. One, from the last video we shared that peptic ulcers in most of the cases is caused by a bacterial infection. It is called H. pylori bacteria. That is why many times when you go to the clinic and you have stomach pain, they tell you to do a stool H. pylori test. We usually do that to detect if the bacteria is still there or it is not there. Now, this bacteria is got from contamination of water, of food, of fruits, of vegetables. So it is what we call fecal oral transmission. So if I tell you that you get ulcers from taking food or water contaminated with feces, you may not agree with me, but that is actually the truth. The medical textbooks say it is fecal oral transmission, meaning some stool, some feces are going through your mouth without you knowing to your stomach. So the way of preventing it is by ensuring that you are taking in clean food and clean water. So ensure that your utensils like plates and cups are washed with clean water and dried. They are dried properly before you use them. Otherwise, the water used to wash them could be contaminated with some feces from somewhere. These feces could be through contamination of your water source. It could be through contamination from hands. That can be able to cause you this condition. So ensure the utensils are cleaned and dried before use. And then two, ensure that the food that you are taking in is well kept. The food is kept warm and you do not go, these days people are hustling and working so much, you come back and jump on cold food and you are eating it, without thinking. After some time you start getting these symptoms and you're wondering where it has come from. So ensure that food is kept warm, food is kept clean, in clean utensils and in a good environment. I am Dr. Bale. I am a private health practitioner running a medical center in the Tororo municipality in eastern Uganda, and also the founder of BOBALE Healthlink Clinics Uganda, which is an online clinic. The online platform, we are able to see you from wherever you are across the country, whether you're in Kampala or in western Uganda or in Karamoja. As long as you have a smartphone and data, you're able to access our doctors online. We have specialists in the platform. We have general doctors. We have a mental health expert that can be able to attend to you from wherever you are. In case you need some laboratory tests to be collected, we are currently able to pick samples from Kampala and within eastern Uganda. We do your lab tests and then we can prescribe your medication that you can get from wherever you are. Kindly subscribe to our YouTube channel. If you're following us on TikTok, on social media like Twitter or X, you can easily follow us on YouTube and click the link below to join our online, to register to our online platform. It is at a free cost. we can be able to attend to you when you need the doctor. You can book at that time, but joining and registering is for free. The third and very important way of preventing peptic ulcers or ulcers in the body is hand washing. Make sure that you maintain good hand washing at home. These hand washing facilities became very popular during COVID-19 time. Kindly ensure that you continue using these facilities. Do not throw away the hand washing facilities. Have a hand washing facility in the toilet with soap to ensure that you are not going back to your house and handling your utensils with the stool or with feces contaminating your hands or any part of the body. Ensure you do proper hand washing from the toilet. Do proper hand washing after your short call. Do proper hand washing whenever you clean the baby. If you are a mother, do proper hand washing at every stage before touching anything like food. Do proper washing for fruits, especially that are going to be eaten raw, because the water, and use clean water so that is not contaminated, because you can be able to get an infection of H. pylori from there that can later on cause you problems. And then also avoid self-medication as the fourth way of preventing peptic ulcer disease. Avoid self-medication, because there are certain drugs that can worsen or risk you to get ulcers. For example, common drugs like Action, like Hedon, like Flucap, like what, they have certain ingredients inside them that can risk you getting ulcers, like prednisolone, like Dexa. And some of you also have allergic conditions. You are chronically taking these medications. Kindly take prescribed medications so that you can be able to prevent yourself from getting ulcers. Thank you very much. Kindly subscribe to the channel. Kindly follow us on X, on Twitter. Kindly follow us on TikTok for more medical videos. Thank you very much.